Good afternoon, Dr. Dalmau. We're here to talk today about the paraneoplastic syndrome and an initiative that Moffitt Cancer Center and the Curran Foundation are launching here in Tampa to deal with that. Could you tell us about what is paraneoplastic syndrome?
Well, first of all, I would like to thank for inviting me to be here and for this initiative, which is much needed initiative in studying these paraneoplastic syndromes. The paraneoplastic syndromes is a very large group of rare diseases. They are uncommon, but there are many of these diseases that can manifest with neurological symptoms or with other symptoms affecting different parts of the body. As a neurologist and neuro-oncologist, I've been very involved with the paraneoplastic syndromes that affect the brain and other parts of the nervous system. So what are these syndromes? These syndromes are diseases or alterations of the function of the nervous system, and by this could be the brain, or could be the cerebellum, could be the brainstem, could be the spinal cord, the peripheral nerves, even the eye, the retina. And what causes this alteration is the presence of a tumor. The presence of a tumor, not of the brain, but most of the times is a systemic tumor, so it's outside the brain. And by mechanisms that for a long time were unknown, and now we start knowing a little bit more, the tumor tricks the immunological system, and the immunological system mounts an attack, try to defend the body from the tumor, but in this attack is misdirected against the nervous system. So in some way, there is a tumor, there's the immunological system, and there is the nervous system. There are three players here. And the tumor tricks the immunological system. It tries to eliminate the tumor, but at the same time, the immunological system attacks different parts of the brain. And this is basically what is the paraneoplastic syndrome. And is a fascinating area of research because also links very much with some complications that nowadays we are seeing with some type of treatments like the immune checkpoint inhibitors that not always is still rare, but some of them associated with similar types of manifestations.
Some of the current cutting-edge treatments of cancer itself are intended to spur the immune system on to attack the cancer. How do you see that tying in with paraneoplastic syndrome? Will that increase the incidence, do you think?
That's a very important question that I think that many people are trying to find an answer nowadays. I must say that some of these types of treatments associate with complications, with neurological complications, usually are inflammatory complications, and there is no doubt that they are linked to the use of these treatments. Everybody knows that, percentage of patients, 20% or even higher, can develop some of these complications. Many times these complications can be solved and the treatment can continue, but sometimes not. And the mechanisms seem to be very closely related to what's called the paraneoplastic syndrome. And it's relatively easy to understand in some way. This, as you are saying, this type of new therapies, what they do is that they boost the immunological system against the cancer, trying to eliminate the cancer. But if this patient has the propensity, let's put it this way, to develop paraneoplastic syndrome that is mediated by the immunological system, when we boost the immunological system, perhaps like side effect, what we see is involvement or effects on the brain and the nervous system. The frequency is not very well known. We recently reviewed this. We published a review on that. And the good news is that we were surprised, my colleague and I, that we did the review, we were surprised that despite that these complications exist, they were not as frequent as we would expect. There are certainly an emerging group of complications, but it seems that they are not as frequent as we thought or we could predict, which are very good news because these are great treatments for the cancer.
Sounds, though, that the immune checkpoint inhibitors are very much a double-edged sword, that they can cause, especially with paraneoplastic syndromes, harm as well as good.
Yes, but the good is here and the harm is here. The side effects are frequent of immune checkpoint inhibitors, the side effects against the nervous system, but these are not paraneoplastic side effects, other types of side effects that can be taken care of. And there is another group of complications that are really truly paraneoplastic syndromes that seem to be boosted or initiated by the immune checkpoint inhibitors. But for reasons that are unclear, and this is great, well, it's not great that are unclear. What is great is that the frequency of paraneoplastic syndromes triggered by these immune checkpoint inhibitors seems to be much less of what one would expect. Despite this, they are there and are forcing us to understand the mechanisms.